What up, what up? Salvador Briggman here. Welcome back to the Crowdfunding Demystified podcast. Hope you've been enjoying some of my other episodes that are out there. So on today's episode, we're talking about something a little bit different, okay? So we're talking about what's called equity crowdfunding. Equity crowdfunding is this whole new phenomenon. I call it a phenomenon because it's been growing year after year after year. And honestly, I think the pandemic just kind of lit this thing on fire. It's exploding. I can't tell you just how big this is. And I'll be honest with you, most people don't realize this is happening and they don't realize this opportunity which is emerging. So if you never listened to me before, that's kind of what I do. I've been really trying to understand myself over many years. So I got started in crowdfunding in 2012, right, with teaching about Kickstarter and that kind of stuff. Started my blog, crowdcrux.com. And I've written a bunch of books in the industry. I've written 10 books in total, 4 of which are mainly focused on crowdfunding, real estate crowdfunding, personal crowdfunding, nonprofit crowdfunding, and then Kickstarter, the Kickstarter launch formula, and also wrote Equity Crowdfunding Explained. So Equity Crowdfunding Explained is probably the most pertinent for this episode, but I'll talk a little bit about that at the end of the episode, so I won't bore you there now. But anyway, this is a phenomenon that's happening. So you're like, okay, what is this equity crowdfunding thing? Well, first of all, you know Kickstarter, right? Kickstarter, people can pre-order your product, they can become a backer, they can become a patron of whatever it is you're doing online. With equity crowdfunding, it's like Kickstarter, except they can actually invest in your company. They can become an investor in your company. You kind of want to think of this almost as like a mini IPO, right? It's literally a mini IPO because some of these companies are doing what are called priced rounds. Other companies are issuing convertible notes. Some of them are doing what's called like a crowd save, where you get at a future point in time, the equity will convert and you'll own shares of the company. Much different ways of doing it depending on the contract which you are investing under. But lo and behold, like everyone's like, this is so dumb. This is such a stupid idea, right? Well, now, I don't know if that's so sure, right? Because this company we talked with today was able to raise $3.2 million with their WeFunder campaign from 401 investors. And the other cool thing is that, it's not just the United States. Literally anyone around the world can invest in one of these equity crowdfunding campaigns. Now, you got to be in the US to start one or launch it right now, at least on WeFunder, but anyone can become an investor. So if you're like, I got this great opportunity and I just need the funding to get this going. Maybe I already have a little bit of traction I could show people, but I really just need that fire to really make this rocket ship go off. Then you want to listen up to today's episode, my friend. Okay, so this person was able to raise 3.2 million, more than that, with their WeFunder campaign, and they're going to get into exactly how they were able to do that, how they were able to pull this off. So you're going to learn tons of different things that are working right now on WeFunder, some of the tactics that they recommend for an equity crowdfunding campaign, some of the things you should be aware of if you are a first-time founder, all of that. And this is for JOGO Health, who basically released, a campaign around wearables, AI, and health. So you might not have a, product in that category, but the way you should think about this is like, how could I use this new instrument for my own case, for my own ideas, for my own entrepreneurial endeavors? How could I use this whole new equity crowdfunding thing to bridge the gap to get that seed funding? Or you're talking about 3.2 million, I mean, that's almost like, Series A, right? Like, how can you use this in order to not only get funding, but also people who are invested in your success and they're willing to tell their friends and they're evangelists. So it's so exciting. I won't belabor the point. It's coming up right after this. Hope you enjoyed today's episode. At the end, I'll talk more about my book, Equity Crowdfunding Explained. Anyway, it's coming up right after this. If you're worried about the fulfillment and shipping part of your Kickstarter campaign when it comes to getting out all those perks and rewards to your backers, rest assured, I've put together a complete Kickstarter fulfillment and shipping checklist for you, and it's free. This is sponsored by the folks at Fulfillrite, and they thought that you should have this checklist as part of your arsenal going into a crowdfunding campaign. If you want to get instant access to this checklist and it's free, you can go to fulfillrite.com/checklist. Again, that is fulfillrite.com/checklist. Fulfillrite.com/checklist. Just go to that link and you can download it immediately. Hey guys, welcome back to the Crowdfunding Demystified podcast. Today we have an incredible WeFunder success story in the house. This campaign has raised more than $3 million already on WeFunder for JOGO Health. We have the founder and also the creator and president here today. Siva, welcome to the podcast.
Thank you, Sal. Thanks for the opportunity.
Definitely. Do you think you could start by just sharing with the listeners a little bit about what you're doing here and the technology you've created?
Absolutely. So JOGO Health was originally came out of NYU here in New York. So what it basically does, it has a wearable sensor that goes on the body. It's an external sensor that picks up the muscle signals, muscle electricity from the body. And you have AI-driven therapeutic applications that runs on a tablet PC and also on virtual reality that trains your brain to help recover from patients having stroke, patients having chronic low back pain, incontinence, and 21 other neuromuscular conditions. So the science is very, very old. It's not a new science, the science of neuroplasticity. What we have done is a science that was dormant and nobody was using. We tapped into that and we have created this. So some people who don't recover from stroke, for example, we are seeing excellent results. People who have chronic low back pain, the ones who haven't recovered with physical therapy or even through medications, we're able to cure them. And also people who have incontinence. One third of women develop incontinence post, and for them as well, we can treat them without medications or surgery. So that's what essentially Jogo does. It's a wearable sensor and an AI-driven platform. Hope that clarifies what Jogo is.
For sure, for sure. And how long have you been working on this?
I'll give you a story behind this. So Jogo is my second venture. So I sold my previous venture, which was an AI-driven drug safety detection that is even currently used to detect the side effects of the vaccines, the Moderna and Pfizer. It's a software that we built. That was my previous company. So I sold the company to one of the world's largest clinical research organizations called IQVIA. IQVIA does all the clinical trials for even most of the vaccines. They work with pharmaceutical companies. I sold the company and I was leading their AI business, the drug safety and pharmacovigilance side. Pharmacovigilance is detecting side effects of drugs.
Got it,
Then
got
that's
it.
when I met these researchers from NYU who were developing this for since 2010. And they came to me and they were looking for funding at that time, angel funding. They showed me this nice little sensor and this therapeutic application. They told me that, patients with stroke and chronic back pain can be cured through telemedicine. And I was fascinated by what I saw. Then I invested in the company back in 2016. Then it was still a prototype at that point. And then they started treating patients. The first patient was a patient in Atlanta who had stroke post surgery. They had removed a brain tumor from him and they treated this patient. And he didn't recover from regular post rehab. When somebody had stroke, they go to a hospital and they've come to a rehab facility, then physical therapy is given to them. And this particular patient didn't recover fully. Then the team treated him from New York, and he made a full recovery. The patient is now playing golf and
Wow,
driving.
wow.
That opened up my eyes and said, "Wow, I mean, this is amazing." Then we had one of my relatives who had chronic low back pain for like almost 15 years. Went to everything that you could imagine on the planet to get treated for chronic low back pain. I mean, starting with physical therapy and all kinds of gadgets they sell online and medication, of course. Then she made a recovery, full recovery for the first time. She said she's pain free. In addition to that, one of my relatives' daughter, she had cerebral palsy. You probably know cerebral palsy is a very condition for
Degenerative,
children.
yeah, yeah.
And this child was in India. And we said, okay, let's try this on this girl. And we shipped a unit to India. And the team from New York treated her. And for the first time in her lifestyle, she stood up. She had to be carried to the bathroom, right? Every day, some parents had to carry her to the bathroom. She's a 13-year-old child. And for the first time in her life, she stood up with some support. It's not like she's running around or anything like that. With some support, she's able to go to the bathroom by herself.
That's awesome. That's incredible. I mean,
That's
that's
the day, that was 2019, end of 2019. And I saw this thing happen with these three patients. And I said, this is bigger than I thought. And I went to my management. I was at IQVIA. IQVIA, if you heard of, it's one of the Fortune's best companies to work for. They're a $50 billion company now, 80,000 employees. Nobody's heard of them. They do all the clinical trials. So that was the company I was at. And I said, I'm leaving. And that was end of 2019, just before COVID hit. And I left the company. And when we formed the company, really took it out of the labs in 2019, December timeframe. That's the story how I ended up being a co-founder. So I didn't create the product. I became initially an investor, then I doing the commercial side of things.
Got it. Understood. Yeah, I mean that's insane, and that's also pretty incredible to be able to have those kinds of effects in general when it comes to medicine nowadays. So one of my questions for you is, to fast forward to the WeFunder campaign, you guys launched this. Had you heard of WeFunder before? Was this something that had been on your radar before?
Yes, so this is how it started, the WeFunder story, right? So when I came out of IQVIA, we invested $2.5 million in the company. That was mostly from myself and also from the IQVIA CEO, who's a well-known figure in the healthcare industry. He advises the president. He's at the Harvard Medical School, so health policy is board of Home Depot, well-known guy. His name is Ari Busbeep. He and I and a couple of my friends invested $2.5 million, right? But at that time, those patients who had used JOGO, they wanted to invest, and we couldn't officially take money from them, right? These are young, patients. These are patients who are not accredited investors. We couldn't take money from them. And there were a lot of stories like this. Many patients and their relatives, including my relative who was cured. Remember the chronic low back pain patient I talked about? She said, I wanted to invest, but I said, we can't take the money from you, officially. I mean, they don't have large amount to invest. I mean, these patients have, $500,000, Then I decided, yes, next round, I'm going doing a crowdfunding, primarily to get these patients and relatives and caregivers who wanted to be part of the deal in the original one, part of the company. So then I was looking for crowdfunding. I never, really experimented on this, and of course listened to some of the stories. Then I, found WeFunder, right, and a bunch of others. Then we finally, got into WeFunder because it seemed like they had a better success story. I don't know about the other ones. So then we said, okay, let's launch a WeFunder campaign, and it just took off.
And how long did it take you to prepare for the WeFunder campaign?
A lot of lessons learned, Sal. So this is again for the first time I'm doing. I didn't have anybody to even tell me what to do. So it took us, I think we might have gone a little early. We should have waited a little bit because we didn't have some of the paperwork that is for WeFunder. So it took us a month, I would say about 3 weeks to launch the campaign. So yeah, 3 weeks, I would say, is what it took to launch the campaign at WeFunder.
Okay, and in terms of some of the things you had to do, so you obviously have a really great video on the campaign, right? You got sort of your story where you're describing what this is going towards and like who the technology behind it. What are some of the other things you had to do before you really went live with it?
So BFIN has two things, right? One is testing the water, so that you could actually do a testing the water before you have all your paperwork figured out. So this is mostly, friends and family. So the first 24 hours, I just sent it out to my friends and family who were actually wanted to invest in the previous round anyway. And we raised like $1.2 million, $2.5 million within 24 hours commitment, right? People said, okay, I'm going to commit. So that didn't need anything. I just need to just launch it. It's not even public. It was just meant to friends and family. But when it really goes live, right, after testing the water, you need to have audited financials. You need to have audited financials, which we did not have at that time. That was number one, which should, I would say, anybody who's raising have that done already. It's like going public because I'm taking
Yeah.
for, and I didn't know that was a requirement, real requirement. So it took us some time, and that was one that we needed to have. The second thing, this is an interesting. Maybe it's unique to us, but maybe other companies too, because we were originally raised funds from accredited investors, like famous people. We needed to have the executives and officer insurance, like the director's insurance that you need to have, because this is almost going public. So if there was anything that people come after, you need to have the board of directors protected. So that was something we did not have either. We had to get it before we went live. So I would say get the financials audited. If you're going to launch more than $1 million, you need to have your financial audited.
Yeah,
Then you
definitely.
have insurance, which is a requirement even in the IPO. It's like going like a mini IPO, right? So
100%. Yeah. What was it like when you started to see people actually investing on this site? I mean, you have a pretty straightforward video. You just kind of doing a video you filmed there, talking to the camera. You got your pitch there, but you were able to completely smash your goal, and it's almost sold out now, right? What did it feel like to really have that level of resonance with those investors?
yeah, I mean, we had even guys come in and asking to invest $1 million. So what you're seeing there is only the WeFunder side of the story, Sal. We have actually raised $4.5 million. That was some of them we could not take it through WeFunder because they were these were people that we came to know about it. So there was one guy who said, "I'm going to invest $1 million." So I said, "We can take it through WeFunder. You are an accredited, you're a large investor." And we didn't even end up not taking his money. We only took $500,000 of him. So there were a few others that we had to take outside of WeFunder through the Form D, which is the traditional way of getting money. WeFunder is Form CF, right? If you're familiar with that terminology, I'm sure. Yeah. So we took so you're going to see the number go down in WeFunder a little bit in a couple of days because we had to take some of these guys outside of WeFunder and go through a Form D because they were investing large amounts, right? So total, we have raised $4.5 million, but all of them is because of this campaign went viral among patients mostly. So it was interesting. So if you look at all the notes that people are writing on our campaign, they all have a family member who has chronic pain or they have incontinence. Somebody, they have a couple of veterans who have incontinence. They have chronic low back pain. So I think the thing about this crowdfunding is when you have something meaningful, something that really impacts people's day-to-day life, these campaigns I think would be very, very successful because we are doing something that's an unmet need, right?
Yeah, definitely. And did you do anything in terms of introducing this to your own network? Like, did you tell people ahead of time you were going to launch this campaign, or did you just kind of launch it and then just start promoting it that way?
No, definitely. I told my friends and family before I launched it. Well, after we launched the Test the Water campaign, I told the friends and family because I knew this is going to go good because most of these guys wanted to be part of the previous round. So I had to just tell them, hey, listen, I had a webinar with these folks who wanted to be part of this, and I told these folks, and they brought in their friends. Then we got random people that we haven't even met before wanted to be part of the company. Yeah.
Super exciting, man. Yeah, that's so cool. And to see something that you're doing resonate with people in that way, where they are actually putting their money where their mouth is and they're spreading the word. And I mean, that's just awesome. It tells you're really hitting the nail on the head with a problem right there.
Yeah, I mean it's not another social network, right? It is something that is solving a problem, and the track record of I think some of the things that people that I know investing because I've sold a company before, so they know that I won't just leave a large important company and come join this. So that kind of might have played a role as well, Sal, in folks that knew me. But then the rest, the large amount of money came from people I haven't even met. I don't even know because they probably did their own research and found out about this. Yeah.
What did you learn from that previous exit that you can share with the audience that I think might also be applicable if they're interested in investing in your current one? Like, what did you really learn from making that exit? To be an entrepreneur, to do that is such a rare thing. Can you tell us a little bit about that?
Right. So my previous company, again, just to recap, goes out and finds unreported adverse reactions to drugs. Right. So this is an AI tool which goes into social media sites, goes into call centers, goes into hospital call notes, wherein it finds unreported adverse reactions. One of the startling facts that you'll find out is only 9% of adverse reactions are ever reported. So let's say you're talking about Moderna vaccine, Pfizer vaccine, people are having side effects. This is closely monitored because it's a pandemic. You take just another drug and only 9% of adverse events are reported. But the pharmaceutical companies are required to monitor them, and there's a law behind it. And they didn't have a tool at that time. They had the human beings going and looking at this. So I solved the problem that was very particular to pharmaceutical industry because I came from pharma. I worked in pharma for 20 years, so I know this problem. So then I came in and I started this company. It didn't do well, and we started during the financial crisis, and there were so many lessons that I learned. There was no crowdfunding at that point. I didn't have funding. The clients that originally I thought were going to sign up, they never signed up. So it was a struggle for first 2 years when we started the company. Hope there was a crowdfunding site at that time because it was hard to even explain to VCs because VCs were shut down at that time as well. So it was a big struggle. Then we got our first couple of clients signed up. Then, quickly this turned into something interesting. And the AI was starting, and this is in 2012 I'm talking about. And then we started getting offered to acquire my company, right? So one of the lessons I learned in the last company was I took money from folks I shouldn't have taken money from, right? Because I was desperate. Folks who never understood pharmaceutical industry, they're trying to take this tool into places that doesn't apply, for example, financial industry, where there was not even a need. So the lesson I learned in my previous company was just because somebody's giving you money, don't take it from them because I took money from the wrong guys, right? From the last. Yeah. So that was the first lesson that I learned. The second lesson was, I was able to sell the company. I could have stayed and I could have sold it for a much, much larger amount later. But I thought, given everything that was going on at that time, I would make the right decision for my employees as well as the investors. And the lesson was sell to the right partners. I sold it to the right company. I had 4 offers on the table for the company at that time. 3 of them were consulting firms. The other one was a real company like IQVIA. Selling to the company was a huge, big thing because they were the right company to sell. Not everybody's going to have this opportunity to sell. Selling a company is a big deal. But I had the option to sell to the right company. But I sold it without being very, very greedy about it, right? Because if I had thought, okay, if I stay for another couple of years, my company will be worth this much, that much. I had some decisions to make because we were financially scraping through at that time, although we were slightly profitable. But I thought that was the right. But once I sold the company took off. Most of the acquisitions don't go well. This is one of the most successful acquisitions probably this company made. And I was able to grow the business 100% year over year, CAGR. And that gave me a lot of confidence how to build a scalable business even after selling the company. And my advice is easy to give, but I would say sometimes companies wait to be, unless you're extremely sure about some markets, I would say if an exit opportunity comes, it's not a bad idea to exit.
How did that come across your table? Were you trying to network with people to get an offer? Did they just start emailing you? How did that come across your table?
So again, everything has a story, Sal. So I was trying to raise my next round of funding. Remember my last company, I raised from the wrong guys and they were not helpful. So I was in Atlantic City at an investor conference pitching my company to investors. This was a large investor conference. Then I get a call from this company and they said, hey, we're interested in talking to you. We're looking at acquiring you. Are you interested? And it went on straight on, how much do you want for the company? What are you looking for?
Wow.
Right? And then 2 days later, 2 other companies, they wanted to acquire the company. So I guess we might have been in the news that we were doing something interesting. And I probably did good marketing in terms of getting the company prominently in the news media because we were solving some interesting problems. Right? We were finding adverse reaction. And that was specifically when social media was taking off on the regulated side. Right? In 2012, Facebook for the first time allowed pharma companies to be on. And they said you need to have a monitoring in place because people would be seeing side effects of the drugs. So there was something brewing, and Facebook was going public at that point. There was a news about regulated industry. So all these played a role, I think. So we got somewhere noted. And also, I think, not Gartner, I think some other company ranked us in the social media analytics side. Although we were on the compliance side, they ranked us as one of the leaders in the space for pharma. And all these might have played a role. And these companies were looking for some differentiators, and they called us. That's how it happened. So, yeah.
Exciting, man. What round of funding were you on? Because I know that's obviously a big job too, is you're trying to balance the day-to-day of operation and management with also raising more capital. What round of funding were you on?
So we were into Series A. We had a seed seed round at that point, again, raised from a company that said they're going to incubate us. So it was basically the seed round, but we were profitable, scraping through, right? Profitable, and we had revenue. But this was pre-Series A or Series A, I would say, that I'm trying to raise at that time. Yeah,
Got it. And how big was the company, you would say, at that point?
we were 14 people.
Okay, it sounds like you made a big name. I mean, that's huge, that impact that you're having with a team. It sounds pretty efficient. You were working smart.
Yeah, we were 14 people and very small at that time. After the company was acquired, when I was leading the company, my team, my business, right, that I sold became a 2,000 person business.
That's crazy, man. That grew like wildfire there.
Yeah, yeah. I mean, people say you sold the company early. I never regretted that. I never regretted selling for less. That was the right thing because, we might have even gone belly up. Who knows, right? If we didn't raise that kind of funding. So the things will happen for a reason.
Yeah, definitely. I mean, that makes a lot of sense, and especially you have so many unknowns, right? And you don't know if one of these other companies could have tried to compete with you, even instead of buy you, right?
Yeah. I mean, our biggest competition that was brewing at that time was IBM Watson. That was brewing because they were into healthcare, and I was scared. Initially, I was scared, and I thought, okay, these guys don't know what they're doing. Then finally, they folded the company. IBM Watson Health closed. I don't know whether you know the story last month, because they couldn't figure out the things that we were doing. But we were competing basically with them because they came in and said they could solve this problem um, with a higher price tag, of course. So that was something that was in the horizon, just scaring me at that time. Yeah.
Was that the first time that you were working in more like a corporate setting, or had you worked in corporate before? Because I think for a lot of startup founders, there's the whole solving the problem and the operations, but just like figuring out the whole corporate side is another skill set almost entirely.
No, I had the opposite style. I worked in corporate. Remember, I worked in pharma before I started.
Okay, got it. Yeah.
Worked in. That was one of the reasons I was able to navigate the corporate world, and I still remember when I sold the company. You have an earnout, right, with the company when you sell your company. But I knew when I went to corporate, if I have to, just be very selfish about myself and try to get the money and get out, I knew that they didn't have the infrastructure or the skill sets to make my this company that I sold into something big. So I basically gave up on my equity and all these things, and I said I want this to be successful because I didn't have the kind of money that I needed to make this being successful. Although it's not going to personally benefit me, I said I'm going to wait and I'm not going to reach some of the targets. For 18 months, I'm going to build my team, then I will launch. So it turned out, I mean, they were very nice to me, the company. Very, very good. I'm very happy about it. That's why the CEO of the company is investing in my current company, right?
Yeah, that's a big testament.
He's huge. I mean, if you don't know him, and I would like Google you, he's a darling of all, and he could have invested the entire amount that if I needed for this company, if I didn't if I didn't take the crowdfunding route. But the trust I had from him, and that was a huge deal. And he's pretty well known, and that was the trust, and I was able to build my business in a very transparent and non-selfish way inside his enterprise. Played a major role. I mean, some of the guys who are investing in my company are employees of that company who knew me. So trust is important, Sal. Trust is important because majority of these founders, quick money, quick exits, and you just have this kick out of it, then you just disappear, right? You don't want that. You want to be known in the industry as genuine. Those are some of the things crowdfunding will work for you.
Definitely. I mean, that makes, in my opinion, it makes every future thing that you're doing so much easier when people trust you in the industry. So I just have a few more questions for you, but I didn't know if you could talk at all on the specifics of your exit or if that was more of a private matter.
Oh no, that was definitely because they were a public company. They didn't want us to publicize the numbers, especially Sal, right? Yeah.
Yeah, definitely. Okay. Well, so in terms of this new round of funding that you're doing, I understand that you're offering a convertible note. A lot of people aren't familiar with what that is. Do you think you could just kind of shed some light on what do people get if they consider becoming part of JOGO Health?
Yes, a convertible note is a future equity, right? Basically, let's say currently we are raising at a 20 million convertible note. So let's say you are currently investing your notes, you're giving us money, loaning money to JOGO. That's basically what a convertible note is, right? You're loaning money to JOGO. And once when we raise a next round of funding, which is Series A, you will be converted at 20 million, but not 20 million, but a discount of 20 million. I think it's 20% discount that we are giving. So let's say next round of investor comes in and they're going to invest in the company at a $20 million valuation. It definitely could be more than that, but 20 million is the limit that we have. But current investors are getting a discount off that. So you're actually getting a discount from the next round. That's number one. Then you're also getting an interest on the money that you're putting in, and that interest also goes into your equity, right? So those are two advantages of convertible notes. So think of like, hey, I'm trusting you, giving you a loan in the simplest terms. That's what convertible note is. And that loan will be converting in a future equity at a discount, right? And that is 20 million is the cap, right? But if the company gets raised money at $30 million valuation, right, you still get 20 million valuation, right? You as an investor at this point, right? So let's say suddenly we do something crazy and the company is valued at $100 million for the next round. You as an investor still gets that 20 million valuation. It's a huge discount.
Yeah, that's pretty big.
Yeah.
So, I was looking through some of the comments you have. So definitely, people are really interested. It looks like you have people who are scientists that are investing. You have people who are just normal mom and pop, experience chronic back pain that are investing. So you have a lot of interest when it comes to what you're looking to do in the future here. If you are successful, you raise all that you're looking to do. What do you think you're going to use that money for, and what are you going to do with this?
Right. There are two critical things we need to do, Sal, right? One, we already have FDA clearance, right? FDA has cleared us to treat certain conditions, right? But that doesn't mean in the United States you're going to make money from day one, right? You need to have a payer pay for it, right? Because we are not a cash market in the US. So our next step right now is negotiating reimbursement with payers. This is Blue Cross Blue Shields too. And that requires a lot of time and effort. I mean, typically what happens in the pharmaceutical world, soon as a company files the FDA filings, they start the conversation with the payers. It takes about 4 years for them to figure out the rates that they're going to get reimbursed on, right? We were surprisingly cleared by FDA much earlier than we thought, right? So we got the clearance during the pandemic. So we did not prepare for the payer negotiation, which we thought only would happen next year, but it happened quicker. So the money that we're raising right now, currently we're going to be using to pilot with payers, and I say payers, third-party payers, this could be Medicaid, Medicare, to show them that this actually is saving money. Because you can get an FDA clearance, they don't give anything about it. They didn't give any. They want you to save money, right? That's what the payers are looking for. So we want to prove them that JOGO is better than physical therapy, or JOGO is better than opioids. Of course, it's better than opioids, right? But JOGO is better than a regular rehab that somebody gets from stroke. So we need to show that kind of money saving, they call it HEOR studies, which is called health economics and outcome research studies that are necessary to save money for these companies, right? That study that we have to do, that's one of the reasons we are raising money. That's number one. Number two, we have to generate little more evidence on this on the clinical side. That's to make sure that the doctors are prescribing. Although we have the FDA clearance based on historical data, we need to produce more data so that a physician confidently writes a prescription for patients to take it. So those are the two areas that we are currently focusing on. And the other things, we are commercial already in India. The reason India happened was, remember, we launched the company just before COVID, right? 2019 December. COVID hits, then US has collapsed. US COVID situation last 2020 spring, you know what happened, right? We are talking about March, April timeframe last year. We said, come on, nothing's happening here. So India invited us, one of the state governments. They said they have a problem in this neuromuscular area. They helped us launch in one of the cities. And that just took off like crazy. I mean, there's an unmet need in India. Then we were able to launch and we started generating revenue already because the payment system is so easy there. And we need to put a little bit of more effort there because I'll give you some numbers. The incontinence market in India, people having incontinence, it's $19 billion. The $19 billion market in India, just incontinence alone. It's a large market. It's unmet need. India doesn't, basically patients are getting prescriptions for drugs, which is main cause of dementia. So there is a whole effort towards going to non-medical, non-pharmaceutical efforts, things like this. So
big market.
Huge market. It's a cash market. There's no insurance there. So people pay out of pocket. So there's no negotiation that we have to do with something like here in Blue Cross there. Just simply people pay out of pocket. And we need to just put a little bit of effort there so that revenue also increases. So that's
very cool.
3 areas that we're going to focus on with the money.
That's exciting. Yeah, that's super exciting, man. And if you guys want to go check it out, you can go to JOGO Health on WeFunder. That's JOGO Health, WeFunder.com/JOGO Health. So you guys can check that out, learn a little bit more about what they're doing. So my final question for you here is, if you could speak directly to some of the listeners of this podcast who maybe admire what you've done with your previous company, what you're doing with your current company, do you have a final tip that you would like to leave with some of the founders, entrepreneurs, creators in the audience in terms of either a word of encouragement, advice, something you wish you knew, anything along those lines, and we can end on that note?
Yeah, I am a big fan of crowdfunding. And remember, I'm saying no to some large investors at this point, right? The guy who wants to write a $1 million check, we're saying no. I would like, especially products like B2C, this is purely touching people's lives. If you're building something like this, where you're actually selling to people directly, or it's going to impact somebody's day-to-day life, I would say definitely, and I would encourage going the WeFunder or the crowdfunding route. People may say, hey, if you go crowdfunding, VCs don't like it. It's not true. All our VC friends are happy that we're raising this funding. They get the validation from this. So that's not true. So I would definitely encourage you to go and do crowdfunding. It is a much bigger, it's the whole affair, whole encouragement or the positivity that gets generated out of this. This is amazing, which you don't normally get from typical venture capital world, where they're very, no offense to them, of course, I like all of them, we need them in the future, but the positive vibe that you get from this is amazing. But be prepared for some paperwork stuff, I would say. Get the audited financials done. They're just raising $1 million. I don't know how much it's going to be helpful. You need a little bit more money. So therefore that you need to have the audited financials. Definitely get your E&O insurance so that your directors are protected. And even if a venture capital comes in, they are protected. So that's an important one. But I would say just go for it. It's amazing what this has done. And I've lived in both worlds, raising money from venture capital, raising money from this. But B2C, especially something that touches the patients, so touches the end consumer, is this the best thing? B2B, I don't know. I haven't seen any companies raise. Maybe there are some ones that are successful. But B2C, absolutely, this is an amazing place to raise money.
Well said. Awesome, man. Thank you for coming on the show. Congratulations on all your success thus far. Can't wait to watch you hit some more milestones here. So thank you for coming on.
Thank you, Sal. Thanks so much for your time. Thanks.
Thank you for listening to this episode of the Crowdfunding Demystified podcast. Again, on this episode and on this podcast, we talk about everything crowdfunding. And today, we obviously went into equity crowdfunding and WeFunder specifically, and how you can raise a boatload of money using this whole new equity crowdfunding thing. So, I think that one of the big things when it comes to this is just like understanding the process. Like, talk to me about some of the other processes that you've gone through, man. You've gone through maybe a process of applying to school, or a process of applying for a job, or a process of hiring someone if you are an entrepreneur, or buying a house, right? There are so many processes we go through in life, and the more you understand the process, the easier it gets, right? Because the first time you do it, it's always a little bit difficult. Second time you do it, it's like, oh, that was a breeze, right? So my role in this process is not to do it for you necessarily, though I have helped other people raise money successfully on WeFunder. So if you're interested, I could help you there. But my role here more so is to teach and to share with you a proven process in order to knock this thing out of the park, and also to give you every step that you need to pull this thing off. So if you're feeling a little bit uncertain and you're talking all these different things, I gotta do this, I gotta do that, what's this whole test the waters thing, gotta file a Form C, blah, blah, blah. There's a lot that goes into it. I talk a lot about this in my book, Equity Crowdfunding Explained. So if you want to learn a little bit about that, first of all, you can go to crowdcrux.com/equityaudio. That link is crowdcrux.com/equityaudio. Crowdcrux.com/equityaudio will take you there. You can listen to the Audible version of the book. The other thing is that if you kind of want to just like speed up this process and you want to learn a little bit more and you're like, Sal, I would just love to be able to talk with you and like just ask my questions and get this squared away in 45 minutes or 1 hour, right? Then the next link is going to be most pertinent for you, which is my coaching link. So you should only book this if you are serious, if you really want to use this time well, right? If you really want to make sure that you're doing this by the book, you're doing it right, and also that you maybe even want to consider some alternative ways to market it, right? So, and also like, there's just so much that's working right now that's really interesting in terms of marketing techniques for these campaigns that there's a lot I can share with you. That being said, you can go to this link, crowdcrux.com/coaching. That is crowdcrux.com/coaching, crowdcrux.com/coaching. That link will take you to my coaching form. You can fill that out and we can talk about it. But the one thing that I would take away is that this is just starting, okay? This is just starting. There are going to be so more success stories I'm going to be having on the show. We are already seeing tons of successful campaigns that don't even have necessarily that good of a video, right? And that are able to raise millions of dollars with WeFunder and equity crowdfunding. It's insane, right? So this is a moment in history. And do you want to look back on this moment in the same way like with crypto, right? With like Ethereum or Litecoin or Bitcoin and be like, I wish I got in on that earlier, right? This is a moment in history. This is something that's happening. This is what I call a phenomenon. You want to be a part of this. If you are looking to get funding for a project or a startup or technology gadget or a venture of some kind, you want to be a part of this. So I hope that this episode was useful for you, it was inspiring, that you enjoyed it. If you're listening on iTunes, please give me a positive rating and review. If you're listening on Spotify, that'd be great as well. And with YouTube, just give me a thumbs up or leave a positive comment. It would mean a lot. Like this is something that I do obviously as a labor of love, but it's also meant to be useful for people. So if other people see you upvoting and commenting, they're going to know it's worth their time. And that's really, at the end of the day, we just want to help people. We want to put out good quality stuff. Hope that you enjoyed this. Again, my name is Sal, and I'll see you next time.